monetize.
Mo gani sa ito kay iya.
Ano na ito din na?
Maiko kung sudah sa oy.
Wala ka ko dili na.
Oh, sa istorya na monetize sa kung YouTube. Claro.
Bata-bata mo yung YouTube. Hindi mo sa animation niya. Teacher mo sila. Panalagay ko na subscribers. May nani. Pag-ibig ko na rin ba? Pwede na mag-uparta na na. Pwede na basta na hindi siya basta sa study. Nangitan ang kwarta din ko.
Kami nasa Davidan. Saan na ni?
Pwede tayo. Ano ka nang... Sa basketball. Ito ng shoes.
Ignorante kayo. Wala mo lupan. Ano? Dito pa.
Bender. Asa ka maabot?
Organa nag-uras. Tuman ako uras. Mo kaya ko ang communication. Ora ko sa iya ha. Ito palit. Natuloy ka sa niya at laro kayo nahubat or sa bakit. Ibligya pa niya. Hindi pa ba? No, mo siya mapalit. Sa muna ang mga tikuha o kung oras na iya. Ganito. Palit mo siya. Tugan ka ni Warren Bills na mga grabe sa siya. Mo siya
Nasa Amerika na.
Nato siya ko ang sa unang wala. Sa nang igor na. Mamutin matay. Igor lang ko para dire. Kanang isa lang na igor. Igor na ka ng Pilipino. Si igor na din.
Hindi ko luto. Kailangan siya doon. Ricardo, tingin ako na.
Katulog na taon.
Ay, tuloy sa natin. Daman na pala, dapat pa-monetize. Of course. Hindi kaya kwarta. Ay, joke lang na eh.
Pwede na nagda? Oo. Luya. Sabang sa kanya.
Igam sa taon ka na. Sana.
Rockstarling, may nalesta. Napila mo na na-select at Rockstarling? 15. Tawa na ng 20 na slide. Kagilan na lang tayo.
Mga 20s, 23.
Taka 1/4.
I-skip din yung mutalan ka ni Rocksterling. Nanang Mr. D.
Natagin lang kayo. Kung ba na kay kuha naman na? Kanang mga...
Dakar na tanan.
Ano? Sino? Ayaw, di raw.
Tawag video sa tayo. Ano? Nasa yung page natin upload yung ginagawa.
Grabe ako, break up in Dubai, stop.
Napod? Okay, Gilmar.
Tilisin, tapos lock, tapos.
Si Teresin.
Di na kung gano'n sa bulibulis, kasi yun ko. Almost 2 weeks ako check-in, kaya kita Yo kali, sige na. Naman ko si Tilisin, lock.
Hindi ko siya nag-number pag-gawa sa
Di mo na ulit.
Ha?
Ulit na yun.
Pinagani. Toto man ka ato ko ano ko. Tapos na ko.
Hindi, bawal mo ito.
Kung ano pag antibiotic na yun. Ay, basta-basta take antibiotic ko yun. Ikaw, hindi na ko
Na,
Saan mo na? Nay, so you explain mo na.
dili, money na asa sa ulo.
Ako sila ni
Ah,
na diri ka.
bawal ako. Wala ako iisip.
So, ayun.
Ano kayo sa tayo? Kasi galing gabi ko alam.
Hindi ko makasagot ng ganda. Hindi siya yung
Tungkol saan naman po diya, Koy?
mas matangkad yung gabi.
Tingin ko lang sa isip ko doon wala sa
Si Bumbong ay
Asa to si Biliana? Nasa Biliana dito. Biliana, menarik ba ka?
Wala, noro sa man na kayo.
Burn flow?
Wala, kanang bayong mataran.
Isa kayo palot sa manok ko na eh. Stricto kayo, burn flow.
Ang sa probinsya. Kaya mo naman na under training. Under training.
Ha?
Under training ba?
Lagi? Buti pa yun dyan. Ikot. Bigla yung loading ko eh. Forty-five minutes. Asan ka?
gawag sa siyo.
Ha?
Gawas na ko lang nila mga sa
Wala man yan.
check na po na doing.
Ay, garpo.
Daily. Check up.
Bigay electric. Kulay ko na electric.
At talaga, don't touch my birdie. Touch my birdie. Okay, so nakabot pa dyan na ka na eh. Naku kayo. Ibutang na rin mo ang slide dito. Saan?
51.
So, today we'll be discussing left ventricular contractility. Okay? So, left ventricular contractility is specifically defined as the form on the ventricle performance of the ventricle at a given filling pressure and systolic pressure. So, we all know that contractility of the ventricle will actually determine the amount of pressure found inside the chamber during contraction. That is why it's sa ilang contractility? Anyone? The force of individual myocardial cells during maximal contraction. Okay. The contraction force generated by individual myocardial cells can also be changed by a mechanism that is independent of the length of which cardiac muscle is stretched. Okay? So, aside from the force during contractility, students, your heart actually works like a rubber band. Kailan mo rubber band? Right? So, kana siya, the more the cardiac chamber is stretched, or the cardiac area, the ventricle is stretched, the stronger the force of contractility. That is why, for people who suffer from degenerative structural conditions in the heart, once the contractility and the compliance, or the ability of the ventricle to really stretch to accommodate more preload, also means that is why imugahi na nila, wala na compliance ang heart, the heart is not anymore compliant, there's a chance that it will cause decrease in the overall contractility or the force of the area during contraction. Okay? It makes sense man sa if the heart has only a very few or the chamber has only very few blood inside, once it contracts, it will gamay ra sa nangiyahang mugawas. So, in short, some of the force in contraction actually increases as much as the heart stretches. Okay, as the heart stretches even more, the force during contraction also becomes greater. Okay, just think of it like a rubber band, di ba? If you stretch the rubber band, the further you stretch the rubber band, the stronger the whiplash will be. Kana ibuhin mo. Okay? Whiplash may rubber band ba? Anyway, so end diastolic ventricular volume is determined by the ventricular preload. So end diastolic, so we're talking about the preload na specific na ng mga parts. End ventricular preload or diastolic ventricular volume is determined by the ventricular preload and the ventricular compliance. So let's go back to this one. So what is preload? What is preload? Man, what is preload?
Amount of blood inside chamber before contraction.
Yes. But aside from the one that enters, the blood can also exceed the capacity of the ventricle by stretching. So compliance. So both the amount of preload and the amount of blood that enters through the use of compliance is added, and that will become your end diastolic ventricular volume. Okay? The ventricular preload is the pressure within the ventricle during diastolic filling. Okay? Because the ventricular pressure changes through filling. Normal values of preload in diastolic ventricular pressures are about 5 mmHg for the left ventricle and 3 mmHg for the right ventricle. In a normal heart, ventricular pressure at the end of the diastole is essentially equal to arterial pressure because the AP valves are open widely during this late quad. So it's stated here that in a normal heart, ventricular pressure at the end of the diastole is essentially equal to arterial pressure. Ano man? Why do you think it's equal? Atrial. Ano equal mo siya? Ha? Dapat students, pag-1 lang kalita lang ang dito.
Ako na ka lang. Sa na
Ngayon mas mga pwede lang ng isa. Mamay mo na. Looked students, if this is the heart, why is the pressure here needed to be equal here during diastole? Why does the pressure it's stated there that the ventricular pressure at the end of diastole is essentially equal to the arterial pressure because the AV valves are widely open during late diastole. But students, why do you think that the pressure in this area during diastole, we're talking about diastole, is always equal to that here? Very good. Para why backflow? Because if it's not equal, this is positive, this is negative, ang tendency ana mo, usaka ang blood. Doc, is that a bad thing? Yes. Because if the pressure here is greater than that of the atrial end, the AV valves will close. Mura ba yan siya flap? Ang imong AV valve, mura ba na siya ginana? Okay? And it's attached by the chordated vein. Okay? So if ever the pressure goes or backflows, there's a tendency that this area here will close. Okay, so it's created in such a way that if the pressure in the ventricle is greater, the AV valves will close. Okay? So, but Doc, why man Doc equal man dyan sila? Why do you think equal siya sa atrial? Di ba dapat unta, supposed to be it is less or negative compared to arterial pressure. Ano? Normal values of preload are about 5 mmHg for the left and normal 3 mmHg for the right ventricle. In a normal heart, ventricular pressure at the end of the diastole is essentially equal to atrial pressure. Ano naman? Equal man siya. Because during that time, students, equal pa na siya because all the blood has already transferred. And we're talking about end diastole man. So during the end diastole, all the blood has already transferred. And once that happens, students, there is no more movement of blood during the end of diastole. And during the end of diastole, as diastole begins to end, the pressure will start to increase, closing all the AV valves. So the reason for the semblance or the reason for the pressure is the opening of the, so ito ka kanina about? AV valve. Very good. Okay? Any questions so far? Wala question? Let's continue. Which increases left atrial pressure? Which third increases left ventricular freedom? Okay? Sila ko nagputol. Which increases left atrial pressure, which in turn increases left ventricular freedom. So students, by the end of diastole, pressure in the atria will start to increase. Okay? So kung ma-increase ang pressure dire, what happens to this area here? So, if this is greater, this is lesser. So, by that time, the blood will start to move back na into the what? Into the ventricles. Okay? So, that will increase your preload. So, an alternate name for Starling's law is the heterometric autoregulation. So, Starling's law na natin. Okay? So, this name implies self-control or autoregulation of stroke volume as a result of different hetero-initial volumes. Metric, that is heterometric, refers to the end diastolic volumes. Okay? So, it's just the other term for Frank Starling's law. End diastolic ventricular volume is determined not only by the preload but also by ventricular compliance. Like I said, it's not only the amount of blood that enters the area during relaxation, but how much excess blood the chamber can accommodate by stretching. So that is called your compliance. A compliant ventricle is one that yields easily to preload pressure and fills with blood during diastole. By the way, what is the source of preload pressure? What's the source of preload pressure? Contraction of the atria. The atria will actually contract as well in order to create positive pressure to push the blood into the ventricles. And once getting in the ventricles na siya, eventually, the pressure in the ventricles will eventually increase by the pushing of the, of course, mapuno man siya blood, as volume decreases, the pressure here increases. Diastole pa na ha, wala pa rin contract ang ventricle. That excess pressure is the one that stretches the ventricular wall. Okay? So that is why compliance is also reliant on atrial pressure. Did you follow? Follow mo? Ako sa likod. Follow ra? Kuhan, siya gano'n kung gano'n nag-iili mo? Ha? Kira? Wala ha? A compliant ventricle is one that yields easily. Kung saan pasabot na yields easily? Meaning, a compliant ventricle is quite flexible. You don't need that much force in order to allow stretching of the ventricle. That is why, students, as we grow older, our cardiac output will also decrease because the walls of the heart will eventually be replaced as we live. The walls of our hearts will eventually be replaced by someone. So may i-replace itong heart. It will be replaced by scar tissue. And once that happens, students, your ventricles will become more rigid. And once it becomes more rigid, it is less compliant. So in order to be compliant, this atrial chamber will become thicker as well. Kung thick yan ko na siya. Ano man? Because in order to push or to allow compliance of the ventricle. Literally, your atria will push the ventricle to become compliant. Okay? Wala na point na slide. The ventricles become less compliant, they are stiffer, or best describe the material as being more rigid. Rigid ha, dahil. Inelastic connective tissue in the ventricular walls prevents increase in ventricular volume above 90 ml. Okay? Myocardial ischemia, certain cardiac diseases or mere advancing age. Like I said, magkatiguang ka, less ang compliance ng heart because of the scarring tissue and the morphological changes as we grow older. Okay? Muna yung mga mamang papa, ayaw mo pabadlong. Si Gomez, klaro na badlong mo yung siligan. Si Kuan dyan, isa mo tila yung badlong mo diri. Si Daito, saan? Tugtugos Daito ko, badlong mo kayo. Okay? So muna, students, one of the reasons why ang mga tigulang magkahinay because their hearts are less compliant. Okay? An elevated preload necessitates elevated atrial and venous pressure, which leads to edema. Okay, like I said, if there is unnecessary blood that is left during a cardiac cycle, eventually that condition will lead to congestion. So students, ang congestion will eventually become edema on the adjacent structures. Example, if your left ventricle has congestion and your left airway has congestion, what organ do you think will become edematous? The lungs. Okay? If this structure here becomes has congestion in this structure here, will cause problems where? Liver and peritoneum. Dok, nga na dili man padong sa utok. Nga di man ang superior pinakaba. Nga naman dyan ang gravity. Very good. So, congestion of your left atrium will result in liver edema or edema of the peritoneum. What do you call that? Ascites or ascites. Ay. Sorry, ascites. Okay? Or some people call it ascites. So, asa man na? Asa mag-accumulate ang water sa ascites? Sa peritoneal space. Okay? So, kana asa mo ang ng tubig sa inyo nga lahat. Hindi na ko na-explain. Okay? Any questions so far? In addition to preload, compliance, the third factor that affects ventricular and diastolic volume is the length of time. Like I said, refilling time. Okay? Refilling time. So, a quicker heart does not always mean greater cardiac output because a heart that beats quicker means it has less refilling time. Less refilling time means less blood enters or less preload. Less preload means less stroke volume. Okay, I think it's self-explanatory. Okay? Nerves, go on. Very good. Go on, Miss Iris, go on. Very good. So, increase in ventricular contractility causes decrease in ventricular and systolic volume. Contractility refers to the pumping ability of the ventricle. When increased contractility, there is more complete emptying of the ventricle. So like I said, once your ventricle becomes too strong, it will eliminate or it will move all the fluids, or it's very efficient in moving all the fluids out of the ventricle. That is why increase in contractility or the strength of the contraction means there is decrease in ventricular and systolic volume. Meaning by the end of systole, because your ventricle was so strong, very few blood is left because of a strong contraction. Okay, did you follow? That is why most athletes, people who are athletic, will have increased contractility of their heart, and their end diastolic volume is, our end systolic volume is so high because, are so low because their heart will pump everything outside that, or their cardiac output is very high. You follow? Miss Kwan, okay ra? Ang last slides, nakuha ra? Our lows, right? Sino na no, the Miss Linteria, nakuha ra? Sure? I-explain kung saan na siya na. Go. Sige na, kana na iyong nasabtan. Sige na, para makaibaw ko. Wala pa na mo kasabot. Wala nagpalikon kasabot kaysa magdalit niya, wala mo kasabot. Yan, gamay na sa cake score. Sige na. Explain daw. Bisa kung saan na iyong nasabtan na part. Masama ng end-systolic volume?
Amount of blood na mabilis sa ventricle after sa systole.
Very good. Pakpasa tayo. Napos piloso. Thank you, Miss Neteria. Very good. Okay? Ay, pakpakin ninyo kay Napos piloso. Thank you, Miss Neteria. So yun kasi yung wala na ang ma-explain. Okay. So like I said, increase in heart rate does not always increase cardiac output substantially. Okay. Although initially, usaka nila yung cardiac output because your body is, the cardiac cycle is shorter. So more cardiac cycle can fit in a unit of time. But because of the law of preload and refilling time, that increase in cardiac output due to tachycardia is not that substantial. Meaning, there's a small increase, but like I said, it's a small increase. That is why if you want to become like Manny Pacquiao, you need to train daily in order for your heart to react to stress, not by increasing your heart rate, but by decreasing your heart rate. Okay? Para na, si Carton, doon kang soccer, right? E gawa na mong soccer, kung your heart is used to pressure or used to an increased demand during games, instead, di ba, normal reaction na to, if we're going to fight mode, we're going to have tachycardia, right? But bali sa mga athletes. If your heart is well trained, your heart will actually slow down during what? During stress. Na naman, because your heart is synchronized to increase the preload. It does this by increasing the contractility. That is why some athletes have a thicker heart muscle compared to other normal people. Okay? Also said, their contractility and compliance is very high. Meaning, matingalang anak nila, kuan man na sila, to the echo well not stress, ilang heart literally akong pag-ayo din. Whoosh! Dagan kay blood mo gawas. Okay? That's so cool.
Dok, ang parang kuan ba, bradycardia ka is applicable na siya sa athlete or believe na siya sa mga regular
Dili, ang bradycardia itself, it refers to slow heartbeat. But athletes are exemption anak. Meaning kung athletic ka na tao, it's understandable that you should have bradycardia. Okay?
Kung normal tao, Dok, na-adyo na isang
Normal na tao, not necessarily. Kaya may what's normal na tao? Ay, athlete tayo, abnormal di ka. Dili. Depends, magod. May nga normal na tao, kuan, kanang It's subjective, manggod. Pero, depende sa ilang demand, sa ilang environment. Remember, your heart actually adapts sa iyong trabaho. Of course, kung heart ka ni Messi, you're designed to do what Messi does. Okay? Pero, ang kanamagong normal is just the standard rule. Okay? Pero, too much of something is bad. Ang ilang bradycardia is only like decrease in pila ka beats. Like 55 instead of 60 or budwell lang ara na number. But kung imong heart rate 40 per minute lang, bro, something is wrong na dyan with your heart. Sakit na sana siya. Okay? Sa heart man good, it is an enclosed environment. Too much or too little of something is bad. Okay? So, go ahead. However, if the heart rate is experimentally increased above its normal levels with electrical pacemaker, cardiac output increases somewhat but not in proportion to increase in heart rate. Students, kita naman na sa TV. Do you know what a fibrillator is?
Yes.
Like, clear, boom, right? What does the fibrillator do? Yes. What does the defibrillator do? Students, usually mogamit kang defibrillator if you are having an arrhythmia. Okay? Kung saan ang arrhythmia daw? Your heart, for some reason, example, mag-atakihon imong heart, maka-feel siya na way oxygen iyang kwan. So, ang buhaton sa heart, upaspas na siya o beat. Right? Upaspas siya o beat during heart attack or mag-arrhythmia ka. So, this is where the defibrillator will come in. From the word defibrill, or iyang buhaton, he will restart your heart. Meaning, once galing igong ang defibrillator, your heart will stop beating. It will enter a repolarized state. Example, asa to? Example, imong heart rate, inani na. Diba? Ang normal heart rate kay inani. Diba? If your heart rate is like this compared to a normal heart rate, what happens to the refilling time during this part? High or low? You can't even see a refilling time, right? Oh, what are refilling time happen? So, if in any condition, that is where the doctor will use a defibrillator. Okay? By the time galing maigo ang defibrillator imong heart, flat line. Then, the doctor will give, will give adrenergics in order to restart your heart. Mga students, if nagani mag-defibrillate, ayaw intaw kong hikap sa cut 3 during that time. Kaya ang 20 mo dagan na sa imong body, mo stop sa imong heart. Tinuod na. Isa na kanuha na Call of Duty. Diba, ang medic, magdaog defibrillator, iyang alaon ng ultra, that is actually mas accurate pa na siya kaysa teleserye. Kaya, tinuod na, alaon nila yung ultra defibrillator para ang heart mo stop. Dili sa teleserye na, wala naglihok clear, mabuhi manoon. Yes, sayop na. Ha? Sayop na, students, ha? So, students, wala pa dyan yung replacement for CPR. Once gani mo stop mo heart, CPR na, dili kay i-defibrillate mo samot ka, sayop. Okay? So, ito ano? Dili. Oh, sayop na. Dili na mo mata ang heart. Good. Oh, ganun. Okay. Ito ko sa Bruselita.
Kasi magamit ako ba? Kaya mo yung nakita.
Oh, kuya kayo. Yeah, then again, kasi may ito ng teleserye, my God. Wak ko sila yung kwarta pero nagkasunis. Diba? CPR ka. Or you can give adrenergics. Dili ka i-defibrillate mo. Una na, CPR ni kung naka-defibrillator, hindi ka dapat mag-CPR. Hindi, sayop na. Kung magbuha ka, mag-defibrillator, there are two different things. One is to make sure your heart beats. The other one is to make sure that the rhythm of your heart restarts. Diba? Tagsar kayo mo magkita. Guys, you will know a person kay igong defibrillator mo, lakra na. Kita mo, kita lang. Mama nga kita na. Jutin mo. Ako, kita mo kay Juan. Lakra dyan na.
Ano naman?
Dili, mga 1-2 months, mulakra na. Hindi na mawa. Init ba kayo na? During Juan, for a brief moment that's so hot. Like literally, mapasok yung gamay ang flesh, anak. So, makita dyan mo. Asa ka gi-defibrillate. Oo, dapat yan ay clothing. Daw, kung sa may benta mo, daw, if na clothing, i-defibrillate. Masunog ang clothing, samot kasunog ang imuhang. Buhay. Pasyente, ha? Question daw. Ngano daw na ilami daw na ipan. Ngano daw ang usa na adre. Kaya kung maoning torso sa tao, na imong heart diha, i-design mo na siya na, example, dire ibutang ang pan, so that maigo niya ang heart.
Hindi dapat dali.
Dili. Ano man? Asa bang imong heart igo dire? Even. Ano asa man ni? Lungs yung igo. Dapat ana na siya. Mura siya i-pinch ang heart ba sa location. Ha? Then, ang gamit ng gel, nana siya gel, diba? Nana nila, para ma-restrict natin yung masunog ang buwan ka, di ba siya?
Start now. Ano to siya po? Hindi
So, it's stated here, like I said, the kusog ng limong heart rate, increasing heart rate reduces diastolic filling, the resulting reduction in end-diastolic volume reduces stroke volume, and therefore reduces cardiac output. Okay? Ha? Wala kayo sa gawas na in my hometown, sa Melbourne, char. Wala. Unfortunately, wala for gawa gani. Wala. So, mamagay tayo nila dialysis. Dialysis, pero rare kayo.
Battery sa motor daw, Dok.
Ha?
Battery sa motor lang.
Ha?
Battery sa motor.
Magpatay sa?
Battery sa motor daw.
Hindi na pwede yun, dapat. Grabe na ka-accurate.
Kaya jumpstart ko sa dito.
Kaya na pwede na doon.
Jumpstart.
Tumukay, jumpstart ang heart. Okay. Sympathetic nerve activity increases ventricular contractility through the action of the neurotransmitter norepinephrine, which activates the beta adrenergic receptors. Pila ka mo adrenergic receptors? Okay. What's the beta? Beta 1 and beta 1. Okay? By the way, if that medication is to increase the contractility of the heart, that is what you call a inotrope. Ano na, kamo what is an inotrope? So if ever gani usa ka ang imong contractility of your heart, that is called a inotrope. Okay? Receptors on there are receptors in the ventricular muscles, and they are represented or they are stimulated by the Purkinje fiber tube, by the pacemaker. Receptor leads to an increase in influx of extracellular calcium. So what happens, man, if there is an influx of extracellular calcium? So, like I said, very contagious ang calcium when it comes to the heart. Once one cell releases calcium, it forces the rest of the calcium channel to release even more calcium. The more calcium released by the calcium channels, the higher the contractility or the force of your heart. Okay? That is why, students, if contractility of the heart is very strong, what is the end result in your peripheral blood vessels? Huh? Students, if ang imong heart usog kaayo contractility, it will result in, of course, that pressure has to go somewhere. That is how you get your hypertension. Okay? So, if you are hypertensive, meaning the contractility of your heart is very strong. That is why doctors want to decrease the contractility of your heart. Okay? Bisag wa ka nagdagan, naglingkod lang ka, yung contractility sa imong heart, tabla lang nagdagan ka, that is not also good for the blood vessels. Yes. That is why, if you're going to block the adrenergic receptors, you would use something called a beta blocker. Isa to? Beta blocker. So the beta blocker will decrease ventricular contractility and will also decrease heart rate. Nga naman decrease man ang heart rate? Because your reaction to adrenergics will always be tachycardia. So, unsa to? Beta blockers will decrease heart rate and decrease cardiac contractility. That is why they are also called negative inotropes and they are also negative chronotropes. Okay? And also, beta blockers. By the way, what type of action man yan buhaton? Is it physiologic? Is it receptor? Unsa man? So, it is receptor. So, beta blockers, mga ulol man na sila, they're actually receptor blockers. Diba? Telulol, yes. Oh, metropolol, right? Okay. So, ano siya? Like I said, so kung you want to block adrenergics, use the adrenergic blockers. But if you want to block the calcium, saan mo gamiton? Calcium channel blockers. Okay? So, decreased cardiac contractility is the hallmark of general. So, if ever get too much decrease in contractility, will result in a condition called heart failure. Meaning, it will become heart failure if there is a decrease in your total cardiac output. If you suffer your cardiac output, heart failure na siya. Okay. Heart failure can result from coronary artery disease, myocardial ischemia. So, what's ang myocardial ischemia? So, ilang ischemia, Miss Tuan? Miss Princess? So, when you say myocardial ischemia, there is temporary loss of perfusion or blood in the area. Okay? Ang kuyawan na, if it becomes myocardial infarct. Okay? So, if there are temporary decrease in the blood supply of the myocardial cells, those myocardial cells will eventually weaken. Muluya siya. That is why if maluya ka, it will result in decrease in cardiac output known as a condition called cardiac failure. Okay? Myocarditis, toxins. Myocarditis is inflammation, like I said. One of the hallmarks of inflammation is the decrease in function. So, inflammation of the myocardium could also decrease its total function. Okay. Any questions so far from starting slow? Nakuha na ninyo? Next is murmurs or abnormal heart sounds caused by turbulent blood flow through the cardiac defects. Okay, so normally students, you only have two heart sounds. A lung and a dum. Any abnormal lung sound could mean that a certain structure within your heart is causing abnormal noise too. One, it's causing abnormal noise. Those abnormal sounds are called heart murmurs. Why are they called murmurs? Diba kung murmur ka, diba it should be, dapat din itong murang kagalit mabantayan, right? But it's there, you said it. For example, God, tawag ka rin. Buta na rin mo kung ano eh. Buta na rin. Buta na rin area eh. Kung ito. Or mana siya, kuhan. Buta na rin, kung ano eh, ni Beryl. Kung ito. Diba? It's a murmur. Ningon kong maayo, dako yung kayo, butan kay sa Biliana. Kung ito. See, that's a murmur, right? Diba? Pag-try ko sa klase.
Wala naman yun.
Diba? So, like I said, so those are extra sounds. Okay? They cause certain conditions that indicate certain structures in the heart are abnormal. Okay? So students, kailan na mo open the tetralogy of Fallot? Then, recite the tetralogy of Fallot. Nabawa naman kayo mo nila, mamutundon din. Ha? Upo ka daw si Brian, wala?
Naupak ka mo.
Teresa ko ah. Kung saan yung mga kuhan lang may Google niya, ang sabi itong tetralogy of Fallot? It's actually there. So, the first thing about the tetralogy of Fallot is that ventricular septal defect. Right? Meaning, there is a hole in between your left and right ventricle. Right? So that is a hole in between your left and right ventricle. What else? There is a foramen ovale. Right? Foramen ovale. So the foramen ovale is a hole between your two atrium. Okay? Normally students, normal na sa fetal life na ay foramen ovale. Kaba mo ano? In fetuses, it's normal to have a foramen ovale. But ideally, dapat it should close the moment you draw breath. Meaning, iginhawa sa animal, that foramen ovale should close. Nga naman, nanay hangin suti mong mama. Nayanin mo na? Wala. So sa matris mong mama, sa animal, walay hangin. There's no air inside. That is why this foramen ovale was designed to bypass the lungs. Fetuses have a circulation as early as 20 days old for dogs. Nanon na sila yung circulatory system. But, wala may hangin bypass in fetal circulation. That is why wala na siya na-open na siya during that time. But dapat, by the time muhilak na ang first na dog, dapat X na siya, close na siya. So that the heart will pump, buagi na siya sa lungs. Okay? Same sa with your ventricular septal defect. Okay? Meaning this hole inside is used to bypass the premature lungs. So, sa to, what are the two members pa ang gingon sa technology of follow? BSD and Kubale. So, there will be transposition of the transposition of the great arteries and there will be thickening or hypertrophy of the left ventricle. Alright, hypertrophy. Right ventricular isolate. So, the right ventricle. Guys, starting from the hypertrophy of the right ventricle and transposition of the great arteries, that is what you call a compensatory mechanism na. Okay? In order to create, because every time this ventricle contracts, some of the blood goes here, the ventricle eventually thickens to accommodate the excess pressure. Okay? And transposition of the great arteries means that blood is able to visit the lungs even though these two structures are present. That is why students, usually children with tetralogy of Fallot usually survive. As long as by a certain age, these two problems are corrected. And if these two problems are corrected, the rest of the body will correct itself. Okay, so nice surgery wala ko ka-assist, but I've handled patients with tetralogy of Fallot. The one lang dyan is that their cardiovascular system is not that developed. So what you do is that they are almost activity intolerant. Hindi na rin mo pa-jogging na like tetralogy of Fallot. Because their cardiovascular system will worsen if they exert effort. But igayo nila, as tolerated by the doctor, they can live normal lives. Like normal dyan. Like normal lives. Okay? So students, emphasize the tetralogy of Fallot because one of the reasons for tetralogy of Fallot is the VSD, ventricular septal defect, will actually cause abnormal heart murmurs. Okay? So ventricular septal defect is a hole or cleft in the ventricular septum. Blood flows to VSD from the left ventricle to the right ventricle. During ventricular systoles, because systolic pressure is much higher in the left ventricle than the right ventricle. Okay, so VSD, kasi nakalayan sa VSD sa tetralogy of Fallot. When you look at tetralogy of Fallot, from the word tetralogy, the four conditions should be present. But there are some times that only ventricular septal defect is present, or there's only foramen ovale is present. Either way, ang problema mo kung na yung mga shortcut mo ni sila. Okay? Kung naagani shortcut ni sila, once this area contracts, the pressure is greater here, right? Some of the blood will go back into the right ventricle. Okay? So that is why, commonly, if you have ventricular septal defect, it is accompanied by hypertrophy of the right ventricle in order to help push the blood into the left ventricle. So to push the right ventricle will push blood back to the left ventricle. Did you follow? Kira? Systolic turbulence is created if the aortic valves do not open wildly. So students, some bacterial infection such as that on your Streptococcus aureus, kailan mo Streptococcus aureus, no? It's also common in, basta may common yan na sakit sa tao? Ito na. Sore throat. That is why students, how does sore throat affect you? If you get too much sore throat, like example, magka-sore throat ka like 7 times in a year, that streptococcus will go into your heart, and do you know where it likes to live? Do you know where it likes to live? In your ventricle and in your cellular valves. So they like to live on the surface of your ventricles. Okay? That is what the condition you call rheumatic fever or vegetative arthritis. Kaya the bacteria will colonize your heart and form certain structure on the valves. Once those valve structure becomes big enough, they would cause abnormal sounds of your heart. Okay? So, yes, also heart work, obviously. Kung na-work yung heart, nahitipino. Okay? Any questions? So, PDA, patent ductus arteriosus, dili na first, kasi na, public display of yatay. Di ba no? So, ano mo na, paglakaw ko maya, PDA kayo mo na mga public display ng mga yatay. Yaya ko kayo mo lakaw. Jadi pa nyo kung kaakig eh. Pagpakilig ko. Anyway. Naman, go, PDA. Di ka maminaw sa mga may ulo pinok nila.
Audience ako to.
Saan mo kaya no? Ano mo kinana mo?
Yes. Slide. Paano niya mga to?
Kuya, atang mo sa kanan. Kaingon lagi ko ba? Karon na, maglakaw rin yung, kasi magsimba ko, maglakaw rin ako. Karon kung gusto ko magtaw, makagaba. Ikaw na nagsimba, magagaba ka, maglakaw sa kulon. Jesus. Dapat yung ba na? So may mga zombie. Happy mo sa'yo na ng mata. So sad, right? Magdaba. Okay? Diyan ka, usasad kay naglisod kong lingkod sa jeep kay ang naging uyab na tulong yun ang ano. Diyan, sakto ka sa tinitig. Hindi mo, ganyan, mga tumoy pa lang mo ng lakaw. Ako, may naman ang matong sa jeep. Matong ko sa jeep, pero di ko makasunod tao eh. Kaya matong mo. Sige ka na, yung mga kukuk. Ayan, makagawa rin. Ang may video eh. No, makita rin na sa YouTube na. Okay, so PDA, patent ductus arteriosus. The PDA is also one. It is the last shortcut for tetralogy of balot because, or usahay, it is a structure that makes sure that your pulmonary vein and arteries are bypassed. Okay? So meaning, di ba? Pulmonary vein, pulmonary artery, lungs, pulmonary vein, right? The ductus arteriosus will pulmonary artery, nasi structure din sa ibabaw, the ductus arteriosus from your pulmonary artery will go to your pulmonary vein. Okay? So mabypass niya ang heart. So ideally, unta mo close sa juta na siya na structure during when you are already born. But some people will retain their ductus arteriosus. The problem with that, student, is those structures will also allow blood to mix. That is why, that's how you get mga blue babies. Kanang mga, di ba, weird, nakadong na ba blue baby? They're literally blue. Because they have a defect. Usually, ductus arteriosus nila is patent, meaning magihan pa ductus arteriosus, it will allow mixing of oxygenated and deoxygenated blood, giving them their bluish coloration. Okay? Oh, musurvive. Basta, anihan kaning mga sakit, petrology of Fallot, kaning mga ductus arteriosus, simple na kayo sila ng procedure ron. Mabuhay nyo kani as long as you have money. Huwag pa sila operahe, pero i-opera na nila normal life. Mo lagi nagluhoy kay dugay ka maoperahan ko makay. Wala lang ingon na bilyana. Huwag pa siya na-operahe kay that's the reality din.
Pero ma-survive.
Alin, listen. Bilyana, dugay siya na-operahan kay mahal no? Ano naman siya? Mga lagi akong ingon. Okay? Normally students, kung bata pa ka, survive pa ka. But as the animal or the person grows older, cardiac demand also becomes higher. So, taas yung cardiac demand, automatic dyan na kuwan, tawag kaning, di na kaya sa imong heart ang requirement sa body, eventually your heart will simply fail. Mamatay yun ka. Mamatay. Pilay na kung mamatay. Si Otso, no? Mga lagi na. But, like I said, ang taning sa imong kinabuhi, itakatel because mag-agad na sa imong heart. As long as kaya pa sa imong heart, mabuhi ka. But once gani the cardiac output is already insufficient, of course, that person will eventually die. Okay? But if ever na kay kwarta, of course, ma-operahan kag dali, like literally, isira mo na nila. Like, kuwara, murang ila na isira. Ikaner na nila. Sira. Yan ikaw human, sira na sa nila. Ang ductus arteriosus, ila na ng putlon. Then, ilahan, tahipon. Okay? It's not really. Kasuway ganito, ibutangan lang balon. Balon niya, eventually i-close ang basta di na magiging tubo, ubikot na na. Ayun. Lagi ba? Dinig? Money. Pero na may mga free karon ka ng mga sa heart. Pero lagi, di ba yan sa wall? Di ba yan kaya sa nila tanan ni tao ni free? Okay? Na. Pero karon ako nindot mag-coverage ang PhilHealth. Sa kwan, nindot mag-coverage ang PhilHealth na it's better than nothing. May giveaway na po. Okay? So cardiac murmurs themselves are not harmful, but they are clinically important. However, because the defects that causes murmurs are also pathophysiological consequences, cardiac defects should be noted yun every time mag-health assessment mo, ha? Okay. So some cardiac defects increase the heart's workload, which causes cardiac hypertrophy. Like I said, if ever gani na ventricular septal defect, in order to eliminate all the blood na backflow from the left ventricle, the right ventricle will also become thicker. Okay? Para ma-increase ang workload. Cardiac defects often compromise the heart's ability to supply systemic organs with blood flow. They need to support their metabolism. Compensating for such pump failure requires one or both ventricles to pump more blood than normal. Mauto hypertrophy of the right ventricle during tetralogy of Fallot in order to compensate for the increase in heart. A skeletal muscle does not work by exerting a force while shortening. The useful mechanical, guys, di na tayo mag-discuss ani kayo humanap ng skeletal muscles, right? So, katong before, wala man daw sila na-discussan mo. Okay. So, guys, lang mo kay kuwara na siya. It's just explanation sa akong i-explain ganiha ha. Diha, naguna din ko. So, one. So, the short, time check. Ayan ba? Ayan ba? Okay, so let us discuss one. Mitral valve regurgitation. So what is mitral valve regurgitation? There is a backflow on what chamber? Left or right? The right chamber. Huh? Left chamber. Right. Right? No. Weird lagi. So left chamber. So if ever what happens to your cardiac output if you have one? Mitral valve regurgitation. Bumalik ang there is backflow of blood in the left ventricle, meaning there is an decrease in your cardiac output. Okay? So, ano naman na? Okay? So students, kabaw mo, wanna learn something good? O saan pag-solve o plan? And mitral valve regurgitation. They fix the valve, right? Di mo mag-ask how they fix the valve? They use the heart valves of cows. Cow. So, magkuha silang certain parts sa cow that are used to replace the heart valves. Okay? Compared to other animals, yes, i-reject yun na siya. But compared to the tissue of other animals, mas compatible na with cows and pigs. Okay?
Okay, okay.
Yeah. Actually, ganit sa pig gani ron, there is what you call a chimera pig. Kaba kasi what's a chimera? So example, if ako usa ka tao, if my genes are composed from many sources, example, na ako yung genes ni Doc Phil, na ako yung genes sa baboy, na ako yung genes sa kabayo, I am considered a chimera. So the chimera pig students is that example, simbakuhan na ay usa ninyo kinahanglan ng organ. Example, wala ito kidney. So what they do is that they get some of your genetic material, they apply your genetic material to a pig embryo. True? Ilang i-change ang kwan. Some of the details that causes rejection in pigs, i-change na nila. Example, kanina gene causes defect or causes rejection by the immune system. So we will change it with her gene. So that pig becomes a chimera of you and a pig. Okay? Kung mananay, dako ni chimera, i-euthanize siya, waon iyang organs, then ibalhin sa imuha. And the risk of rejection is very low because that pig has your genetic material. Okay? Cool kayo na?
Kapag na-DNA ko, parang nag-DNA siya atong nabaw.
Specific din siya. Pero, dali na naman sa nasa. Ang pig, by 4 months old, pwede na ihawon. Actually, it's still under trial, but tawag ilang first ikuan karon chimera to na pig ikuan lang kidney ibalhin nila sa tao na nag-dialysis na ni-improve siya for 3 days but unfortunately namatay siya kalit. But karon naa sa lain na tawag ani nakalimot ko unsa na organ nilang gibalhin. Liver ba ito? Pig chimera gyapon. Hato karon buhi gyapon siya. So that is what you call xenografts. Okay? Ayun na pila. Okay, so di na kayo, mo lang to ha, di na kayo focus sa regurgitation. Okay? Just you know that regurgitation results in backflow of the left ventricle resulting in decrease in cardiac output. Okay? So, let us now discuss insights into the ECG. What is ECG ganit? electrocardiogram. How the heart behaves with electrical impulse. Okay? So we all know that your heart is controlled by electrical impulse called your sige nag-control sa electrical impulse. Sabi na sila. They are part of your pacemaker. Meaning the pacemaker is responsible to control the electrical impulse so that your heart would beat properly. Okay? The events of a cardiac cycle, a normal ECG tracing is present at the top of the okay? So, arterial contraction is initiated by atrial depolarization, which is in okay, yan na. So, ito ang ECG rin. So, this is your pacemaker. Ha? So, before tamukuan, bumalik ko tayo ganita. So, ang pacemaker, this represents your right atrium. This represents your left atrium. This here is the, arterioventricular what? SA node or your sinoatrial node. This one is your arterioventricular node. Why do you think it's called arterioventricular? Because it has connections between the atrium and the rest of the network. Good. So students, that this SA node will diverge through what's the structure? The bundle of His. Okay? So the bundle of His is used to is a fork, or this is where the 2 Purkinje fibers will separate in order to innervate the different ventricles. Question: why do you think there is an innervation here? Or not, the right bundle, left bundle, but these are called the Purkinje fibers. Pero why? Why do you think they are separated? Because students, in a normal animal, this part will contract first, then followed by this part. Okay? If ever wala na sila bundle of His, they will contract together. And if there is a problem with the sequence of contraction, cardiac output will diminish. Okay, did you follow? Follow mo? Okay. So, the AV nodes spontaneously depolarize towards threshold but more slowly than the SA node. Though, I mean SA node students, right? That's inside sa dito yung ECG. Okay? So, kita na mo ECG, wala pa. Basta next week, mag-laboratory ta, mag-ECG ta. Ha? Okay, so, one lang, always know that in the ECG, o sa ganitong duha ka structure na nag-innervate sa atrium, there's two structures. The SA node and the isa pa? Napay isa? Usa na yung atrium. You have your Bachmann's bundle. The SA node innervates the right atrium, while the Bachmann's bundle innervates the left atrium. Okay? The activation of the SA node results in the contraction of the contraction of what? The atrium. And that is called your P wave. So to? P wave. Okay. Cardiac contraction takes place in two stages. The right and left atria begin to contract, and after a delay of 50 to 150 milliseconds, the right and left ventricle contract. Atrial contraction helps finish filling the ventricles with blood. The delay allows time for the topping up of the ventricular volume. Ventricular contraction ejects blood out of the left ventricle and into the aorta. Okay? So in order for the heart to be synchronized, right quad. So first, right atrium will contract, while the relaxed pa, left right ventricle. That delay of around 150 to 50 milliseconds will allow preload to happen. That is the preload time of the heart. Once that happens, students, this part here is filled with blood, then it will contract, putting blood inside the left atrium. From the lungs, left atrium, then the left atrium will contract, and the left ventricle will contract together with the right ventricle. But there is a small delay in time. Okay? Any questions so far? Wala na yung questions? Introduction to ECG. What controls the electrical current of your heart? The pacemaker. What are the two nodes of your ECG? SA node and the sinoatrial node. What happens if your SA node is destroyed? Once the SA node is destroyed, the AV node can actually take over the SA node. What if the both are destroyed? That animal will die. Okay? Any questions? Wala ra? So, let's call it a day for now. Thank you. Go to the Miss One.